everyone, welcome to this session on regrowth with Dr Jyoti Bajpai. Just a bit of an introduction for you. Patient scalp cooling motivation has always been centred really around hair retention, but as patient education increases, regrowth has become really proven to be an important part of scalp cooling and a real benefit. The follicle protection that scalp cooling offers and the resulting clinically proven now faster, healthier regrowth is particularly relevant for those patients who sustain higher levels of hair loss. Regrowth can be just as important as hair retention in a patient's treatment experience, and we really must start to think about that. So a couple of questions which hopefully Dr Bajpai and I will get to the bottom of in our conversation today, but why do clinicians need to be aware of the increased rates of regrowth that happen as a result of scalp cooling? And how can we use this knowledge to support patients as robustly as possible in the future? So welcome, Dr Bajpai. Brilliant to have you here again. I know you've been a popular face in our summit. Can you introduce yourself for us, please?
So thank you, Richard, again, and happy to join this conversation, which is very, very important, in my opinion, for patients' quality of life when they are on cancer-related chemotherapeutics treatment. So, I'm happy to be here. I'm Dr. Jyoti Bajpai, as Richard kindly introduced me. I'm a professor of medical oncology in Tata Memorial Cancer Center in Mumbai, India. And I'm very passionate for, especially young and adolescent, cancer care, because I feel they are having unique challenges and quality of life issues. So scalp cooling for alopecia prevention falls into that particular category and is much more relevant to that young population. So I definitely want to contribute whatever little I can do for this field.
Thank you so much, Dr Bajpai. So you did actually one of the first studies relating to regrowth, so looking at both retention and regrowth with scalp cooling. Can you give us a little bit of detail about what you discovered in your clinical trial, please?
Right. So thanks, Richard. Again, this is a very important aspect. And, while I was designing the trial and I was looking through all the literature, I found that majority of the people, they looked into the hair retention part. However, in the literature, it is well documented that there is varied responses as far as the different chemotherapies are concerned. For example, taxane, there are brilliant results with taxanes all over, while with anthracycline, they are modest. So this was a question into my mind that, what happens if the patients who lose their hairs, what is their, regain rate? And there was no answer kind for that. So I thought that perhaps it's a good idea to explore that as well, because in my opinion, both the aspects are very, very relevant, very important for the patients, because one, they should postpone their hair loss as much as possible. They should perhaps be able to prevent. If not that, they at least can postpone. And if they are losing on hairs, then their regrowth rate should be as early as possible, as max as possible. So this is a spectrum, I believe, and everything is very, very relevant. Because to me, when my patients, even if they lose their hairs, but if their hair regrowth rate can be enhanced, so that by the time they complete both the phases of chemotherapy, if sooner they are able to, go back to normalcy in their normal lives, it is very important, very important milestones for me.
Absolutely, and thank you for sharing that, and also thank you for capturing this data. As we both agree, I think it's so incredibly important. So you just alluded to this a bit, but do you think sort of retention and regrowth should be mutually exclusive, or can patients with significant hair loss also expect to benefit from that faster regrowth?
Again, very intelligent question, Richard, and very, very practical, because, what happens ultimately, when we start patients with chemotherapies and we try to prevent their hair loss by giving scalp cooling, if so I'm giving an example of breast cancer, and particularly my trial, because it was in curative setting in breast cancer patients. So there can be two regimens. We have used uniform. All patients were received anthracyclines and taxanes, which is the standard backbone for breast cancer curative setting. So we have given this kind of schedule for all patients, but we observed that if we are starting with taxane first and later anthracyclines, then they can retain their hairs for long. So the primary endpoint, which is after 4 cycles or 12 weeks of taxane or anthracycline-based chemotherapy, in that particular time point, if they are starting with taxanes, 70% plus patients could preserve their hairs. But if we are starting on anthracycline based, this is not the case. And as we see even in the clinics, usually that with taxanes there is little delayed hair loss, while with anthracycline, in second or third cycle there's complete alopecia, even in clinics. When we are using a scalp cooling, then also chances of retaining at this primary endpoint about 4 cycles later, which is 3 weekly, is around somewhere around 30%. So the remaining patients, they are losing on their hairs. But if they continue to scalp cool, it was so overwhelming to see that in their second phase, that is taxanes, we were seeing the hair buds, they are growing. And it was very fascinating to see. And while the 12 weeks are completing, there is a good amount of hair density which we could observe. And within 3 months' time, which was our regrowth measurement, time point, we have done at 3 months and 6 months both. 6 weeks and 12 weeks both. And in both the time point, there was significant difference as far as scalp cooling arm and non-scalp cooling arm is concerned. So I want to give this very important message that even the patients who are on anthracyclines or even some patients who are on taxanes, if they are losing on their hairs, if they continue to use the scalp cooling, their chances of regrowth rate become enhanced, which is also equally relevant and important.
Wonderful, and it's fantastic that we've got the data to show that now. So what do the patients think about it? So we've got our endpoints, and those are all looking good, and it sounds great. But what sort of feedback do you get from the patients when they start to see this better hair regrowth, especially after they've witnessed this quite dramatic hair loss potentially with anthracyclines, and all of a sudden they start to see this regrowth over that next 12 weeks. What's the feedback you've got from your patients being like?
Patients were extremely happy. And, the patients who were losing on their hairs, obviously, especially because they made a lot of expectations, even when we explain them, upfront about all the details, possibilities, etc. But everybody wants to, see themselves in that positive fraction and never on negative side. So they all think that they're not going to lose hairs. If they are losing, they were disappointed. But once they see that those buds are coming up, and also because there are other patients on the trial whom they can see that on the second phase, majority of the patients, they were fastly growing hairs, and that was very promising. And they were that kept them going and continue to scalp cool their heads in spite of losing hairs on first phase. Very promising and this was very optimistic. That was one of the real booster for them, that yes, they will be able to go back to their normal lives early.
So so you're speaking, Dr. Bajpai, to other doctors who perhaps aren't using this sort of language in their discussions yet with patients. Perhaps they're not even aware of regrowth, to be honest, because it's still relatively new in the realm of scalp cooling. How should doctors be talking, or nursing teams as well, care teams, be talking to their patients about this? How do they manage those expectations? What bit of advice could you give there?
Right. So, we have to be very realistic. We have to be as transparent as possible. And we should discuss at length, in the best of the language, patient and families, they can understand, and more than one sessions. Because one time if we give a lot of information, many times they are not able to register it. Half of time they keep forgetting, and also try to make relevant points as notes so that can be kind of reminded time and again. So we should explain them that this is the possibility of their hair retention, and depending upon which sequence we are using, and we should, also it is essentially a precision medicine, I would say, and counseling should be done while we are taking into consideration who is sitting across the chair with us and what is their knowledge level, what is their mental stability and what kind of information they can register, what amount of information they would be wanting and can handle. So this all is very important and relevant, and I think nurses and other paramedical people, counselors, they have a big role, because very small doubts and those kind of things, they can relate and with patients much more than the doctors, and patients feel very comfortable with them. And while they were, even during the cap fitting, etc., there is ample amount of time to discuss. And my nurses and my coordinators are very popular among patients, and they keep calling them, and they keep keep on discussions regarding those aspects, final aspects. And when they themselves were seeing that there are many other patients who are in different phases of their hair development, they even created a support group, so that the other patients, they can handle the other patients. And when they see in real life that this particular patient is achieving those kind of milestones, they are very convinced.
And you brought up two important things that I wanted to touch on then. So, yeah, who talks to the patient about this? So you've said, that physician involvement early on is important to educate and at least share information about scalp cooling, but then that continuous information that's being fed through from nursing teams and other medical teams to support that patient through the journey. And then I think last, what I really took from that is that peer-to-peer piece as well, that patient-to-patient, which in essence is a bit like our Facebook group as well. And it's such an amazing community, where people do share experience and do share those regrowth stories. So I'm delighted that happens in all parts of the world. And I'm glad you're seeing that and seeing the benefit of that.
And absolutely. And patient trust most the other patient, because they felt very relative with them, because they have gone through the similar kind of journey. And if we say that there's a long road, then they at different points they are standing. And if a person who is crossed that particular point, or a patient A is standing, that can handhold the patient A the best.
Absolutely. What do you say to a patient who has had this severe hair loss and wants to stop scalp cooling? What language do you use? Are you trying to be encouraging? Who normally handles that?
So it's a difficult situation, really, and especially if patients and the patients who are really optimistic. It requires long session of counseling, and to explain them that when we give similar kind of treatment to similar kind of patient, there are variety of responses as far as our efficacy of treatment is concerned, or efficacy of such devices is concerned. It's a heterogeneous world. So we need to explain them that 100 patients, similar things, they will respond differently. But also, in spite of you losing hairs, there is a chance that thread you should continue, I believe, and that's the most important thing. And majority of my patients, they continued using scalp cooling in spite of losing hairs while they were on anthracyclines. Those patients also, they continued using.
Super. No, I'm so pleased that messaging is happening with you, and I hope we can do more of that in different parts of the world where we're very, very aware it's not happening. If you look at our Facebook group, regrowth has now really become one of the main motivators, and that it varies in different parts of the world depending on awareness of that regrowth. But I think within that community, it's very, very clear and very, very much discussed. Do you think that faster regrowth rates have a positive impact actually on a patient's quality of life?
Yes, absolutely. So it definitely affects a patient's quality of life, because whatever said and done for the cosmetics, the appearance, the body image, these issues are very, very important, and especially in young population, it's very relevant. And different part of the world, different kind of women, they come for treatment, and everybody's having a different kind of concern. For example, if I say one of my patients who was a CEO in some company, and she was very career conscious, and she wanted to go back and join her job as early as possible, and wanted to look as confident and as normal as before. She is having a different, different utility of her hair regrowth. Vis-a-vis another patient who was from far interior, a remote village, wherein hair losing hairs and baldness, that was a stigma, and it was it was related with multitudes of things, some bad karma, etc. And for that woman, her hair regrowth, the fast hair regrowth, so that she can be again become part of her family, the acceptance in society, it was having a different connotation. So it is important for everyone. The reasons might be different. That's what was my take home.
Yeah, so culturally, it obviously has a big impact in different parts of the world, but also that recovery seems to be improved vastly as well for those patients who do experience that faster regrowth.
Absolutely. So we found that in our data that as far as the quality of life is concerned, for this domain, the hair preservation domain, it is vastly different between the two arms. So those who can preserve hairs, this particular point was prominently come positive. However, again, I would like to say that we do not have sophisticated tools to capture alopecia related quality of life improvement, which we need to work on and need to develop. And that I found specifically while I was studying very methodically, because for this particular point there was a clear difference. But if we test the entire quality of life scale which is available, because there are so many other domains which is not directly impacted by alopecia, there can be impact of chemotherapy related other side effects, the treatment related other side effects which have more impact. So also I think we need to work on this, that we have to have a specific tool to capture this particular difference.
Yeah, and I think that's been a common theme, hasn't it, throughout the summit, in terms of we must have better tools to assess these things appropriately so they're more meaningful to us in the future. Although I believe we all strongly agree anecdotally, in many cases, this is a patient benefit and it should be a choice for patients, and hopefully we can achieve that globally in the future. So Dr. Bajpai, if you had one piece of advice following our discussions today to your fellow peers, to those clinicians around you, what would that be?
So I think I want to tell all the physicians and colleagues and paramedical staff that you should counsel the patients really well about the realistic possibilities, realistic benefit, as well as this spectrum, that if you are using scalp cooling, this is the chance of your possibility of your hair retention rate. And if you are using this kind of sequence, this much, and if you are using other sequence, this much. However, if even you will become completely bald, or you will lose complete hairs, then also there is a strong hope, and there is a strong chance that you may regain your hairs if you continue in each cycle using this scalp cooling and patiently waiting for that. And that outcome is objectively found in randomized control trials. So that part should be emphasized upfront, because if we introduce this in between, then patients are not so much their trust is not so much common. They should be aware that there are 50-50 chances that you will gain or you will lose depending on what kind of sequence, etc. But even if you are falling into the other side, then also there is a ray of hope.
Well, thank you for that. I think a great piece of advice, and hopefully those clinicians watching and also clinical teams will start to put that into practice. And again, we can share this regrowth data at any point with anyone if they want access to it. So Dr. Bajpai, I'd like to thank you very much for joining me today. It's been a pleasure as always. Hopefully you've enjoyed the conversation as much as I have, but look forward to hopefully seeing you in person in the near future. But thanks once again for all your support. You are wonderful and do so much for your patients. So much appreciated.
Thank you so much, Richard. It was wonderful to discuss. And again, as I said, if I can make a small contribution to improve quality of life of my patients, my job is done. Thank you so much.
Thank you.